GLP-1 receptor agonists, often prescribed for obesity and type 2 diabetes, have become increasingly popular in recent years. These medications help regulate blood sugar and support weight loss, making them a valuable tool for many patients. However, as their use grows, so does the need to understand their full range of effects. Today, we'll explore new research that uncovers a surprising risk associated with GLP-1 use and increased likelihood of tendon ruptures in patients with obesity. Let's dive into what this means for patients and healthcare providers. GLP-1 receptor agonists, or GLP-1 RAs, are a class of medications that mimic the action of a natural hormone in the body. They help lower blood sugar levels and are widely used to treat type 2 diabetes and obesity. By slowing digestion and reducing appetite, these drugs can support significant weight loss, but as with any medication, it's important to be aware of potential side effects. Recent studies have begun to shed light on some lesser-known risks, especially for those with obesity. At the recent American Academy of Orthopedic Surgeons annual meeting, researchers presented new data linking GLP-1 use to a higher risk of tendon ruptures in patients with obesity. The study analyzed over 157,000 patients, comparing those who used GLP-1 RAs with those who did not. The findings were striking. Patients on GLP-1s had significantly higher rates of tendon injuries, including tears of the rotator cuff, Achilles, and pectoralis major tendons. This discovery has important implications for both patients and clinicians. And ruptures are serious injuries that can cause pain, loss of function, and require lengthy recovery. The rotator cuff, Achilles tendon, and pectoralis major are among the most commonly affected. These injuries often need surgical repair and extensive rehabilitation. For patients with obesity, who may already face mobility challenges, a tendon rupture can significantly impact quality of life. Recognizing risk factors is crucial for prevention and early intervention. Study found that patients with obesity using GLP-1 RAs had a 2.4% risk of rotator cuff rupture, compared to 1.5% in non-users. This translates to a hazard ratio of 1.55, meaning the risk is more than 50% higher for GLP-1 users. The rotator cuff is essential for shoulder movement and stability, so injuries here can be particularly disabling. These numbers highlight the importance of monitoring for shoulder pain or weakness in patients taking GLP-1 medications. Achilles tendon ruptures, though less common, are also more likely in GLP-1 users with obesity. The study reported a 0.3% risk in users versus 0.2% in non-users, with a hazard ratio of 1.49. The Achilles tendon is crucial for walking, running, and standing. A rupture can be devastating, often requiring surgery and months of rehabilitation. Even a small increase in risk is significant given the impact on mobility and daily life. Pectoralis major, a large chest muscle, is also at higher risk of rupture among GLP-1 users with obesity. The study found a risk of 0.8% in users compared to 0.5% in non-users, with a hazard ratio of 1.46. While these injuries are less common, they can severely affect upper body strength and function. Awareness of this risk can help patients and doctors make informed decisions about treatment and activity level. For patients with both type 2 diabetes and obesity, the risks are even broader. GLP-1 use was linked to higher rates of not only rotator cuff, Achilles, and pectoralis major ruptures, but also peroneal and quadriceps tendon injuries. Hazard ratios range from 1.33 to 1.53, indicating a consistent pattern of increased risk. This suggests that patients with multiple metabolic conditions may need even closer monitoring when using GLP-1 medications. The research was a retrospective cohort study, meaning it looked back at existing patient data to find patterns. Researchers used the TriNet-X research network, which compiles electronic health records from over 70 large healthcare organizations across the United States. By matching patients who used GLP-1s with those who didn't, and controlling for factors like age, sex, BMI, race, diabetes status, cholesterol, and statin use, the study aimed to isolate the effect of GLP-1s on tendon rupture risk. To ensure the results were as accurate as possible, the researchers used a method called propensity score matching. This technique pairs each GLP-1 user with a non-user who has similar characteristics such as age, sex, BMI, and other health factors. By doing this, the study minimized the impact of confounding variables, making the comparison between groups more reliable. This approach strengthens the validity of the finding. Interestingly, the study also accounted for statin use, as statins have previously been linked to tendon ruptures. By including this factor in their analysis, the researchers ensured that the increased risk observed was specifically related to GLP-1 use, not confounded by statin medications. This careful approach adds confidence to the study's conclusions and helps clarify the unique risks associated with GLP-1. Healthcare providers, these findings highlight the importance of monitoring musculoskeletal health in patients prescribed GLP-1 RAs, especially those with obesity or diabetes. Early recognition of tendon pain or weakness could allow for prompt intervention and potentially prevent more serious injuries. Patients should be encouraged to report any new symptoms, and clinicians may need to weigh the benefits of GLP-1s against these newly identified risks. Authors of the study, led by Jad Lawand, MS, emphasize that these findings warrant further investigation. Prospective studies, those that follow patients over time, are needed to confirm the link between GLP-1 use and tendon ruptures and to better understand the underlying mechanisms. As GLP-1 medications become more common, ongoing research will be essential to ensure patient safety. Patients taking GLP-1 RAs should be informed about the potential risk of tendon injuries. Education on recognizing early signs, such as sudden pain, swelling, or loss of function, can empower patients to seek help quickly. Open communication between patients and healthcare providers is key to managing risks and ensuring the best possible outcomes. Summary: while GLP-1 receptor agonists offer significant benefits for weight loss and diabetes management, new evidence suggests they may also increase the risk of tendon ruptures in patients with obesity. Both patients and healthcare providers should be aware of this potential side effect. Ongoing research and open communication will be critical as we continue to learn more about the long-term safety of these widely used medications.